This is about depression and it's about emotional eating. Let me tell you a little bit about who I am and why I'm doing this presentation. And then if you got questions, again, put those in the chat box. Have any kind of technical difficulties, put that in the chat box as well. I'm assuming everybody can see the screen right now. My name is Richard Yaden. I'm a registered nurse. I'm a mental health and wellness coach. I help people that are going through mental health challenges get through them. Hopefully you're receiving some treatment from a psychiatrist or a psychiatric nurse NP, but just medications and showing up to get those refills every once in a while is not often enough. And sometimes it takes a disinterested third party, I shouldn't say disinterested, an objective third party to help you through that. And that's what I do. Also want to let you know that in this next 30 minutes here, we're going to talk about depression. We're going to talk about the kinds of depression that you might encounter, or maybe you're going through right now, or have a family member that's going through it right now. We're going to talk about why that can lead to emotional eating and what to do about it in case that's a situation that you're in. Before we get too far into it, I got to give a medical disclaimer. This presentation is not to replace any medical advice that you're receiving. It's not to replace any treatment that you're going through. This is for information purposes. If you feel like you need to make a change to any kind of medical treatment that you're receiving, I really want you to go talk to your provider to talk about what you think you need to change and how that might impact. All right. So we got that out of the way. What we're going to do, we're going to take a real close look at this today. The National Institute of Mental Health reports that 50 to 75% of emotional eaters also suffer from depression. So this is very significant. And emotional eating, along with depression, can have some serious consequences, not just on your mental health, but also on your physical health. So when I work with clients, I never separate the two. Your mental health has an impact on your physical health. Physical health has an impact on your mental health. So we've got to look at both of those at the same time. Emotional eating has that. Also, you can feel free to take some notes during this presentation if you want to. However, at the end of this presentation, I'm going to give you a link where you can download a much more detailed report I've put together about this. It's more than I can cover in a half an hour in detail, so you'll want to get that report if you think this is something that would be helpful for you. So we're going to try to get a clear understanding of depression and emotional eating here. We're going to help you better understand it, how to identify what's most important in that. And our aim here, what I want you to come away with in this presentation, is to have a very clear understanding of what depression is, what kind of depression that maybe you're going through, how to identify it, and what kind of steps that you can go through, not just to recover and get through emotional eating, but also get through the different steps of recovering from depression, because that's important too. So depression, let's talk about that for just a moment. Hey, Adrian, welcome to the presentation. So we're going to talk about depression, and depression is something that I think every single person probably experiences from time to time in his or her life. It's not always something that warrants treatment. It's not always something that is going to change your life. But, it's a fact that, normal experiences of life, normal circumstances can sometimes move us into a depressive state. Many people experience this type of thing when they have a change of life, whether a job or they lose a job, or they lose a family member, or they move away, or something like that. Depression is something we deal with in life. It only really becomes a concern when it lasts 2 weeks or longer, and that it has an impact in your personal or professional life. In other words, you're having difficulty functioning in your personal and professional life. So let's try to get through what it is. People that that are experiencing depression often experience periods of intense sadness. They might have strong anxiety. Depression and anxiety often go together. They have a feeling of emptiness, maybe a feeling of hopelessness or worthlessness. And they can sometimes feel overly guilty, overly agitated, angry, just have an intensely restless state of mind that they're concerned with. And again, we all go through this from sometimes, but when it lasts more than 2 weeks, when it disrupts your life, that's when depression becomes a real issue. That's when it's time to think about looking for treatment. Now, you might lose interest in things that you normally really experience. That's another sign of depression. You might have difficulty concentrating, another sign of depression. And one or two of these isn't always meaning you're in a major depressive episode. But when I want to get back to this, when it interferes with your life, that is something that you've got to look at. That's something you have to look at very closely to see if you're in a situation where you might need some treatment. Now, depression falls into a lot of different categories. There's major depression. Sometimes you might hear someone saying they have a major depressive disorder. This used to be called clinical depression. And that's when the symptoms that I talked about persist for most days, at least for a 2-week period. You also have something called atypical depression. Now, in this form of depression, a person isn't always down. Their mood will improve if good things happen to them. If they are experiencing something that would normally bring someone uplifting emotions or feelings, they're not actively displaying many of the symptoms that are associated with typical depression, but it still brings some of the symptoms. And particularly in this type of depression, increased appetite is one of the symptoms. They might be sleeping more than usual. They might be feeling a heaviness in their extremities or an oversensitivity to criticism. There was a study in the Archives of General Psychiatry. It's now known as the JAMA Psychiatry publication. It discovered that overeating and gaining weight are the most common symptoms of atypical depression. There is another type of depression that's called persistent depressive disorder, PDD. This actually affects about 3 million people in the U.S. every year, and it signifies that a person is experiencing a low-grade sadness for more than 2 years. So if you're someone who's just kind of been sad for more than a couple of years, and it's just kind of a pervasive sadness that interferes with your life, that is potentially PDD and something you might want to have looked at. Another form of depression is bipolar depression. Now, bipolar is used probably way too broadly to describe mood swings. It's a very specific definition for the diagnosis of bipolar. But when we talk about bipolar depression, this is an extreme mood swing that includes major depression, but may even be worse than major depression. So that's another type. Seasonal affective disorder, you've probably heard of that. That's tied to seasonal changes, typically worse in the colder months. I remember my son went to college in upstate New York, and he said it got gray beginning around October all the way through December. And there were signs all over the campus that said, hey, if you're feeling low, you're feeling down, come see us in the mental health clinic because it's probably seasonal affective disorder. There are other types of depression. There's a psychotic depression. This is when A depressed person experiences paranoia. They might experience intense delusions, even auditory hallucinations. There's postpartum depression. You've heard about this, I'm sure. Very common in new mothers, but it can also affect fathers. There's premenstrual dysphoric disorder, which is a depressive state that's often linked to a lady's menstrual cycle. And then there is situational depression. And this is the one probably most of us will encounter in our lives, which is a depressive state that's triggered by life events. And it's usually something that's very temporary, like the depression from losing a job unexpectedly, or the loss of a loved one, which kind of feeds into bereavement, but it's also considered a depressive state as well. So what does all this have to do with emotional eating? Now, emotional eating can be a very strong symptom of one of these forms of depression. And as we saw earlier, it's a very much associated with atypical depression. This is sometimes called comfort eating. You may have heard this before in the past. And it's a act of responding to a stressful situation that is compensated by indulging in food. Now, emotional eaters differ from binge eating. I want to make that distinction here, because people who emotionally eat don't always eat large quantities of food. They're not always binging on food like some people do that have a binge eating disorder. But the key to emotional eating is that there is some form of stressful or emotional situation that sets off a trigger that causes a person to want to eat at a particular time. Now, if left untreated, emotional eating can lead to obesity. It can lead to a very detrimental self-esteem issue. It can lead to guilt. It can lead to shame. And other serious complications, including food addiction. There we go. So depression, when a person suffers from an emotional eating, suffers from this condition, they're experiencing stressful situations, and they're going to use food to mask it and to balance out the negative emotions that they feel. And there's actually a chemical reaction that takes place in emotional eating that is tied to the way antidepressant medication works. And we'll talk about that here in just a minute. But the chemistry behind this is pretty fascinating. I guess from a clinician like myself, it's more fascinating than maybe for somebody else, but it's very real, and it exists. The chemical reaction is the same. The chemical reaction is what a person who suffers from an emotional eating disorder is using to attempt to either overcome or completely ignore the stressful situation or the negative emotions that have presented themselves. So rather than deal with the emotions, rather than face the challenging situation head on, an emotional eater will quite simply just turn to food to bring back some feeling of goodness, some feeling of satisfaction in that moment. And it's not to say that this is always a conscious decision. It's not always a conscious decision. We're subconsciously and emotionally trying to compensate for something that is lacking, or we're trying to avoid something that is painful or emotionally disturbing, which is, a big part of what happens in depression. At the same time, though, the same person will develop a reliance on the food because it becomes just another form of medication. And they tend to use it every time that they get faced with a stressful situation or with a depressive episode. Now, how do you identify whether you're going through emotional eating. What is true emotional eating? Well, when people become depressed, their bodies are naturally looking to experience a certain kind of comfort. And for some people, one of the means is going to food. A person who eats often to find this kind of comfort quickly gains weight. Obesity is very closely tied with emotional eating. And that leads to kind of a lower self-image. It leads to a greater depression, which is kind of a vicious cycle. And that leads to the need to find greater comfort. And it means greater food intake, which leads to more gaining weight, which leads to more lower self-esteem. And it's just a cycle that goes on and on. And this kind of cycle is not only very harmful to our mental health, it can be very detrimental to our physical health. So some of the symptoms and characteristics that you're going to find and you want to look out for is a tendency to feel hunger all of a sudden, rather than, how hunger can build gradually for us. People will decide to eat at the drop of a hat rather than eating at a more frequent intervals, like, breakfast, lunch, or dinner. They will consume food at varying times throughout the day, depending on how they feel. A lot of times the craving is for junk food, and it's more junk food than for. Did somebody have something comment? I thought I heard somebody. Okay. So sometimes it's a craving for more junk food, certainly rather than healthy food. And we're talking about chips. We're talking about sweets, cakes, ice cream, fatty foods, real heavy foods. And it stimulates the pleasure centers in our brain. It also brings afterwards a greater feeling of lowness and lethargy. And that often can further inspire us to eat more because we're now not feeling so good. Or we might feel guilty about doing it. And because we feel bad about that, we start emotionally eating again. Sometimes a person feels a lack of control over their eating habits, and they feel guilt after it. A lot of people who are in this state really don't have a choice in how they feel, and sometimes they have to take in more and more food before they get to that level of comfort that they were feeling before. Some of the common signs of depression is somebody that is staying indoors. So if you're wondering whether you have depression, if you're wondering whether somebody in your family or someone you know is suffering from depression, these are some things that you can look for. Not getting out of the house, staying indoors. People spend more times. Usually they'll lack an interest in any type of social interaction, and they have a strong lack of interest in things that used to give them a great deal of pleasure or that they found exciting. You'll also see appetite changes, and these are significant appetite changes, and they can go from one end of the spectrum to the other, such as not hardly eating at all to overeating and getting into that emotional eating. So the emotional eating can be one sign, but there's other things that go on, and a change in their eating habits. And that's really one of the reasons one of the ways emotional eating comes into play is a change in those eating habits. We'll also see in someone that has depression, low self-esteem, and that's a kind of a pervasive feeling that they'll have of worthlessness or uselessness, or they'll have some type of limited mindset. And these, and of course, there are certainly more that persist, may mean it's time to seek professional help. Now, I want to talk about carbohydrates and depression because there's a very interesting link here. And I mentioned this a little bit earlier when we talked about the chemical side of this. Carbohydrates, and we're talking about sugars, things like chips, snacks. These things are loaded with carbohydrates, and it's not the good carbohydrates. Uh, and carbohydrates are a big part of emotional eating. Uh, there was a study from obesity research, and it cited some commentary from two doctors, both by the name of Wertman, that the cravings for carbohydrate-rich foods, which is so common in emotional eaters and very common in those suffering from depression as well, may affect or may reflect low levels of a regulating neurotransmitter called serotonin. I don't know if you've ever heard of that. And serotonin is often seen at low levels in people who are dealing with depression. Doctors Wertman conclude that carbohydrate increase the level of serotonin. Again, this is a neurotransmitter in your brain, making depression symptoms better and therefore promoting the cycle that, oh, I feel better, so I need more carbohydrates. Now, people are doing this on a subconscious level. They're not thinking, oh, I need to get my serotonin levels up in my brain, so I'm going to eat more carbohydrates. But it has that effect. Now, what do the most common antidepressive medications do? They raise the level of serotonin in your brain. In fact, the most common class of antidepressant medication is called SSRIs, selective serotonin reuptake inhibitors. It inhibits the brain from reabsorbing the serotonin neurotransmitter and therefore lowers the symptoms of depression. Much the same effect that eating carbohydrates have. So it's interesting that the same chemical reaction is going on that by eating that antidepressive medications are trying to address as well. So what are we going to do about this? So if emotional eating is an issue, if depression is an issue, there are many treatment forms for depression and emotional eating. First of all, you want to visit your healthcare practitioner to find out what these are. And you can consider things like medication, antidepressant medication. You consider counseling, CBT, which is cognitive behavioral therapy. Self-hypnosis has worked for some people. But there are other treatments that don't involve medications that may be more as effective, may be more suitable, more integrated into your lifestyle. And I'm going to talk about some of those. We talked about medication here just a minute ago, and the type of antidepressant medication that you can have. But let's talk about counseling and talk therapy for a moment, because I think this is something that a lot of people overlook. And if you're dealing with any kind of mental health issue, I want you to think of medication and therapy in a couple of different ways. A lot of times medication certainly has its place, but it can be used as kind of a way to help you get into a stable mindset. Certainly if you're very depressed, or if you're manic in a bipolar situation, or if you're just, consumed with anxiety, you can't think straight. You can't work through things in a rational way. Medication helps you get to that level. But therapy is what you use to help deal with the situation, to find a way to get out of it so that perhaps your reliance on medication can be reduced or even eliminated. So therapy is a very essential part of mental health recovery, and certainly can be a good part of emotional eating. Effective diet management is another way that you can manage your emotional eating. It really comes down to a balanced, nutritionally rich type of diet. Now, before you make radical changes to your diet, it's probably a good idea to consult a qualified dietitian. But many, many studies have shown that the Mediterranean diet is as effective as medication for reducing depressive symptoms. And beyond the scope of this talk to get into the Mediterranean diet, but look at that. There's a very, very prominent study. It's called the SMILES study. You can look that up. That is that looked at people who had severe depression and put them on a Mediterranean diet for 12 weeks and saw dramatic improvements. In fact, my master's thesis was about how your diet can impact your depressive symptoms. So it's often overlooked. A lot of people with a medical perspective, doctors, physician assistants, don't always go deep into the holistic side of how to treat this, but nurse practitioners do that based on their training. So I don't want to get too far on this, but getting down that path is something that you might think about and look at the Mediterranean diet. The most important thing here, though, and we're gonna wrap up here in just a minute. The most important thing here is that you have to decide that you really want to change. If you're dealing with emotional eating, you have to decide that you really want to change, and then do something about it. Either go see your healthcare professional. I do mental wellness coaching. You want to book a coaching session with me, we can talk through it as well. But it's really up to you to make the change and do something about it. So let's talk real quick here about what we've tried to get through here. Understanding some of the symptoms of depression is really the first step for you to go through and understand whether this is something you need to be working on. Hey, there are a lot of treatments available, everything from medication to holistic examples that you can use. The most important thing is that if you are dealing with this, you think it's a problem for you, find support, go find help, and get through it. Don't let it control your life. Recovery is possible. Reach out. You can stay strong. Take that first step towards having a better life and recovering from it. It's something you can do. So again, I've got much more detail on this in a full report that you can download here at this link. I'm going to put that link and some others in the chat box here. You can have those. Let's see. There we go. You can have those in the chat box. So take a look at those. And, I really do my best to keep these monthly events to 30 minutes. We've got a few minutes here. So I'm sorry if I've moved through this really fast. But if there's any questions, throw those in the chat box right now, and I'll be happy to answer them. Awesome. All right. So again, if you think this is an issue, get the report here, mindcarehealth.us/eating. Download that report. You can also email me if you've got any questions after you read it. A lot more detail in there. And then let's talk again. If you think this is an issue, book a session with me. There's no cost for an introductory session, and we'll go from there. All right, guys, I appreciate your time with this, and we will finish up the meeting now.